O kia ora tātou, e ngā mana, e ngā waka, e ngā reo, e ngā karangatanga o te motu. Tēnā koutou, kia ora no tātou katoa. Ko ai au, ko tūto ko te mauka, ko makawhio te awa, ko kaitahu ka te māmoe, me waitaha o iwi, ko ka te maha ki te hapu, no te tai pautini o te waipaunamu ahau. Nō reira, tēnā koutou, kia ora no tātou katoa. Well, kia ora everyone. I really want to thank people for inviting me to speak here today, and I suppose I don't hide my passion for Māori health or Māori health workforce development very well, so I will always take up an opportunity. And actually I don't hide my passion for the fact that I'm actually from the West Coast. I happen to be kukued in Otago, but I am a West Coaster born and bred, and so issues of rural health and Māori health are also very, very close to my heart, and it's great to be part of a group that's hopefully going to help us tackle some of the issues that we have in terms of workforce and land in a place that means that the diverse communities that we have are well served by the health workforce that we have. I've also been really, I suppose, inspired already by many of the initiatives that are out there that I know many of you are already part of, and some of this is about joining those dots and bringing positive things together and working together to get to where we want to land. So I want to tell you a bit about my journey in supporting equity in terms of Māori health, and this has really been a 10-year journey with the University of Otago. So my background is in medicine. After leaving medical school, I trained in psychiatry, and I worked in psychiatry for quite a long time, and then had an itch I wanted to scratch, which was around how can we make a difference at a really big picture level. So I've ended up coming back through public health medicine, and health workforce has been one of the areas where I think we can make a huge difference. So I want to talk about why we're focusing on equity, our journey at Otago, some of what we've learned to date about what are some of the critical success factors that have supported our outcomes, and our next steps, because we're only partway through the journey that we're on. If you look at the international literature about the importance of having a diverse workforce, you'll see things that look like this, and this comes out of nursing research, which really highlights and focuses on diversity, but the important role that diversity has in supporting access, and access leads to reduced disparities, and reduced disparities contributes to health equity. Other models break that down, and what are the mechanisms for why we have diversity contributing to health equity? And some of those come very much at the patient communication level, but it also talks about where people choose to work and the kind of roles they have. So increasing workforce that will support underserved communities, growing trust between communities, patients, whānau and health services, and then also having people in there that are advocates and champions. And I'd like to add another one here that we've certainly seen and observed within our health sector when we've seen the growth of Māori in the health workforce. And there's probably no surprise to people to start to see that we're getting pockets of growth in strategy, policy, commitment to things Māori happening in some really interesting places, some of the colleges in medicine and some of the less well-known specialties. And often when you look at what's behind that, it will be because there's often been Māori staff or Māori communities or Māori people who have actually come in and started to push. So we've got a desire for enabling policy, and it's wonderful to see the prioritisation and policy that's supporting things Māori, but also having the people in there to actually give life to that intent as part of this. And so research that we've done at our unit has really highlighted not just some of those formal roles and the recognised roles. When we researched and looked at Māori graduates from our health professional programs, we found people highlighted many, many things that they were doing behind the scenes, encouraging young Māori to think about careers in health, working with their own whānau in their communities, and very much that collegial providing support for their own colleagues and informal mentoring, and this was happening in all sorts of places and spaces. So the things that we don't often measure are out there, and so growing the workforce allows for those intangible and more organic impacts. And I think very much when we think about the context that we have, then we can think about the advantages of having a full and flourishing health workforce that is Māori out there across all parts of our sector. And we have a long ways to go. And some of this data is taken from very recent, some of it's a bit older, but we know that around between 6 and 9% of nurses and midwives are Māori. And for the programs we run at Otago, only between 2 and 5% of the registered health workforce for these professions and a number of others is Māori. So we look like that tiny little sliver. And so the question that I have is, so what have we missed out on in terms of our capacity as a health workforce to actually understand, to drive, to solve solutions, to actually meet the needs of Māori when we haven't been present in many places and in sufficient capacity to actually be contributing to that. And so often our focus on equity in terms of Māori is we're here and we want to be there, and if we do, we'll get somewhere. But I also think we ought to reflect on the dynamics of not being there in the first place, and what is the implication of that. And some of the struggles that we have, like we want a program and we're going to try and make that program be responsive to Māori after it's been developed, for instance. Maybe we wouldn't be in that situation of always trying to adapt if actually Māori were central and part of the program development to begin with. So there's a whole range of impacts of this, and I'll just mention one of the ones that I think has come out very much, and I think that with underrepresentation of Māori, you have a small number of people who have multiple roles. So I also have a very personal vested interest in growing the Māori health workforce. I counted up all the committees I'm on, and I was well into double figures and more, and I'd love to be able to share the love around. So another great reason to grow our workforce. And then qualitatively, I just want to acknowledge the experience of some of the young people and the emerging health workforce that we have. And so this came from a reasonably new young doctor as part of research. I'm usually the only Māori in the team. I'm always the only Māori doctor. Everyone expects so much, but I'm still training. So it'd be great to be a world one day where our young trainees weren't having to be all things to all people. So how many do we need? And we did a bit of modelling. This is back of the envelope modelling, but roughly if we were going to reach 20% of the workforce, roughly, which is based on the proportion of Māori who are young people in our population, we'd need 13,000 more nurses, just over 2,000 more doctors, close to 400 dentists and 300 and something midwives. If I had a magic wand, might be able to do it, but otherwise we've got to grow these, and you can do the sums about how long that's going to take and the commitment we're going to need to make a really meaningful dent on those numbers. So I call this a tale of two inequities because our health workforce inequity has a pathway that comes from education. And there are huge ethnic differences in educational attainment, and of course for many of the programs we have, we require people to come into tertiary education, often with a background that requires some science, and they have to compete and get into some very heavy duty programs that are often quite intense. So UE attainment, this is a decade of UE attainment, and what you can see for both Māori and Pacific is that's looking pretty grim. So around 25%, and if we think that a small proportion of those are coming out with sciences as part of that mix, then you can see the challenge that we have. So our path in Otago was to partner with the Ministry of Health a decade ago, and the goal was to grow the numbers of Māori in the health workforce. And this aligned up with our policy that we have as a mirror on society, so that our graduate pool would also reflect New Zealand society. So we have a whole range of programs within the Division of Health Sciences, and then also in the wider university, spanning a range of things. So prior to 2010, we had a fairly dismal track record as an educational provider for Māori in health sciences. So less than half of Māori students were getting through to second semester in our competitive health science first year. That's the pathway into the health professional programs. Many of those students came in with educational vulnerabilities, and although there was lots of support, and there's always great pastoral support and some academic support, we were dismally failing those students. So we set up, in partnership with the Ministry of Health, the Māori Health Workforce Development Unit in 2010 to do something about this. We aspirationally had a goal that 20% of students across the Division of Health Sciences would be Māori by 2020. It's 2019, I'll tell you where we got to later, but we started out with 4.2%. And these were very standard approaches to growing things, but in particular Māori led and directed, and a strong social justice agenda and a very clear direction in terms of program development. Some very important policies underpinning our direction, both from the university, from tertiary education and health. And I just want to acknowledge He Korowai Oranga. I think this is a great piece of policy. It positions Māori participation in the health and disability sector right in the middle, and I see Pathway 2 as a link to both Pathway 1 and Pathway 3. So I think if we can do something about the workforce, we will tackle some of the others as well. We have a range of health professional admissions processes and pathways at Otago, and just a new one we've got is a socioeconomic equity one as well, starting this year, Māori, Pacific, Rural. So our approach was, rather than to come in and say what's wrong with Māori, we took it the other way. We saw there is a whole lot of people in the society that seems privileged in order to get their young people, or have young people enter health professional programs. What is that privilege? What does it look like? Where does it come from? How does it work? And then how do we unpack that and repack what we're doing for the Māori students that are coming our way? So over time we've developed 4 programs underpinned by research and evaluation, and our tagline is from inspiration to graduation. These are all evidence informed, they have strong student voice and co-creation, have theory of change, program logic, and Māori-centred and principles. So one of the programs is an outreach program where we work with years 9 and 10 on science engagement, and years 12 and 13 on health science engagement and health professional pathway programs. We have our flagship program, which is Tukahika. These are young people desperate for careers in health but who have had significant educational disadvantage. We provide a scholarship program for them. And then our health science first year, which we completely unpacked, repacked, and wrapped a whole lot of things around it. If this was an educational talk, I'd unpack all of that, but just to give you a bit of a thing, we work very much with peer tutors and supports, and we do a whole range of things with those students over the course of the year, which includes running all weekend physics tutes on the weekend that the big Hyde Street party's on. So we managed to cover Hawara as well. And then we work with our students all the way through to graduation, and we're now starting to do a lot more to prepare those Māori students for what it's like to enter the health workforce. Range of research and evaluation projects, including one that I want to acknowledge, working with the South Island DHB Health Workforce Hub, where we're looking at how do we support really successful transition from our Māori graduates into the DHBs, and how the DHBs can support them through best practice and recruitment and support for Māori entering the workforce. So our outcomes have been exceptionally positive. We have a huge high level of engagement for these young people. We have a high level of return from our outreach programs, and many of the students that we've seen in years 9, 10, 11, 12, 13 come back, and they're now out there in the workforce, many of them. Our foundation program has been hugely successful. Many of these students didn't have UE when they started the foundation program. Almost all of them do by the time they finish. Most go on to health sciences, and many of them talk qualitatively about the huge difference this has made in their lives. These are just some of the graduates we've had coming out of Tukahika, and some of you may recognise some of these. We've got dentists, surgeons, physiologists, physiotherapists, and a whole range of people there. So our numbers have skyrocketed, particularly more recently. And in terms of our health science first year, we had a 40% increase in just the last year, which has created logistics issues in terms of where do we get a room that will take 235 people. And that was on an average of between 50 and 65, 66 before we started the unit. High levels of engagement, and this is what our year looks like. We have to stick them on the floor because we don't have anywhere else to put them. And again, qualitatively, students are talking about this being transformational for them in terms of educational experience. So in terms of health professionals, we now currently across all programs have 369 Māori students across our health professional programs. We have a whole pile more in health sciences and a Bachelor of Health Science. And this is the medical school. We have 264 Māori students currently in medical school across the years, averaging about 20% of the medical school class. So we've hit 20% in medicine, and working there, coming close in dentistry and on the way with physio. So watch this space. So we really have two overarching critical success factors, and one is the foundations and committed leadership, policy, leadership, and a real commitment to this. And then the other one has been around evidence-informed, data-informed, highly effective programs with lots of quality improvement as we've gone. And it really fits into these two things, having the intention and commitment, and then paying attention to what we're doing. And both things have been required. Sometimes people think you do one or the other, but I think you have to do both. So our conclusion is that we can reflect society in our health professional programs. Success requires input and commitment at all levels, but that we get multiple benefits in both health and education. So it's like the bifecta, if there is such a thing. And really, if we want to tackle equity, if we tackle our determinants, we work on health services and we get our health workforce right, I think we can really get to the goals that we want to. So just overall, we haven't got to 20%, but we have got to 15%. So I think that's pretty good of our students overall being Māori. And we have some new projects. And part of that is actually preparing Māori students for the diverse roles they'll have in the workforce. So, kia ora.